Hello, welcome to Optimal Health Solutions channel. This is a channel dedicated to the viewers' enlightenment, mainly on health-related issues. We're going to discuss with you and answer most of the questions that you may have on health, promotion of health, wellness, and the prevention of health diseases in various categories. We will talk about the ways we can maintain our health and ensure that most of the health diseases that are usually discussed, available, that take people to hospital can be minimized to the barest minimum. Can be reduced to the barest minimum. Now, we are in this channel dedicated to enlightenment, health education, and to ensure that we give you the necessary advice which will make you enable you to take decisions on your health and wellness. We'll talk about lifestyle, we'll talk about exercise, we'll talk about diet, but we also will talk about health conditions like diseases of the heart, the eyes, the nose, ear, nose, and throat. We'll talk about abdomen. I will talk about fertility issues, among others. And in this channel, you will see that we'll discuss with experts, health professionals who should know what they are talking about. And indeed, those we will invite here are those who will know what they are talking about. And we hope that you will enjoy this channel, and we also want feedback from you so that whatever questions you want to ask, whatever comments you want to make, we would like to get your feedback as much as possible. For today, we have in the studios a colleague of ours, a medical doctor who has specialized in diseases of the heart and and the blood vessels. That colleague is Dr. Emmanuel Edafe. My name, by the way, is OJ Odia. I'm a medical practitioner, but I've retired from active medical practice. But for now, I will as promote health and wellness and use this channel to ensure that most of our patients do not end up in hospital and they can be managed the best way possible. So thank you very much for joining us on this channel. Dr. Emmanuel,
Yes.
thank you for coming.
Thank you very much, Prof,
And
for the privilege to be with you today.
thank you.
Yes, Professor Dia is my teacher, my trainer, and my mentor.
Thank you very much. But for now, we are going to be the person that we are talking to, and we want to know, as a medical practitioner and somebody who specializes in health-related disorders, in the management of health-related disorders, what are the common heart conditions, heart diseases that we find in your practice?
Very good. Thank you, sir. Looking at the various health issues that relate to the heart and the blood vessels in Africa here, where we live in the sub-Saharan Africa, with the commonest one we usually encounter in our day-to-day practices include high blood pressure, which we call hypertension. Then we also encounter diseases of the valves. The valves may be leaking, they may be narrow, which we call valvular heart disease. Then we also encounter that the heart muscles may become big or abnormal and looks like a inability of the heart to work because of heart, the muscles of the heart not working well. And in medicine, we call it cardiomyopathy,
Or heart muscle
heart
disease?
muscle disease.
Sure, yes.
Exactly. Then we also have some issues with the artery that supply the heart. Either there is a blockage or the contracts not when they ought not to contract. So we call that coronary artery disease. Then we also encounter things like arrhythmias, that is abnormal heartbeats that either come from abnormal
So
points.
normally the
Yes,
heart beats regularly
regularly
from
from a place
birth
which will, from birth
to death.
till death.
Okay.
So the heart supposed to beat regularly, and that beat supposed to come from one source of the firing. But at this point, the beats now become irregular in the sense that it's coming from another source, and another source instead of the normal source, which we call the SC node, giving it, other sources in the heart are now giving it. So these are some of the things we encounter in Africa. Then if you go to Europe and then North America and also India, the more of the things they also encounter there are things like coronary artery disease, where the coronary artery is blocked. It's very common around there. Why in our environment is growing up. Then things like degenerative valve disease
Okay, that is
because of old age.
valves
Yes,
that are no
yes,
longer
no
functioning
longer
well.
functioning well
Mm.
because of old age. So they have all this problem with the valves. Or they may also have because of the artery becoming narrow. They may also the many points in the muscles of the heart now started firing on their own, which we call arrhythmias, that are
Irregular
irregular heartbeats
heartbeats.
that may be dangerous to the particular person. Then the cholesterol also may also be high, may also affect the coronary artery disease.
Vessel that the heart,
Yes,
the blood vessel that supply the heart
supply the
muscle
heart become narrow,
narrow and
and so
clogged with
clots will now
fat.
occur.
Yeah.
Yes, clogged with fat, and it can no longer deliver blood through the vessel or through the pipe any longer.
Okay, thank you very much. So now we have an idea of some of the common heart conditions
Yes,
that we
Prof.
encounter from day to day. What would be your advice to the viewers on what to do? For example, how would they recognize that these conditions they have, the what we call symptoms that they have, is related to the heart?
Very good. The advice I would like to give to the viewers today is that everybody has to be very conscious of his or her health. And if you are conscious of your health, you have to be careful to regularly check your body up. Go to the hospital. There are good hospital, either government-owned hospital or private hospital, to check your body up. Do a total body checkup. Then also what you take in your body, you have to regulate it properly.
For example,
Yes, examples, the type of food you eat,
oh, yeah,
because now we are now evolving from the way African used to live to a European lifestyle. People go to the marketplace and they buy all manner of junk, and they eat all manner of sweet things and they swallow them. And we don't cook proper food anymore because we are changing our lifestyle to European lifestyle. So all these things have to be really properly
address. So
checked
you
up
would advise
and
that
addressed.
we
Yeah.
keep to a normal African diet,
Diet, exactly.
okay, and the home cooked meals
Yes,
that we
exactly.
cook in our
Cooked,
home
well cooked meat.
and eat.
Yes,
But
exactly.
even if we
And
have to
also,
eat outside,
yes,
we'll be very selective.
very
Type of,
selective.
so what would you recommend? What type of food would they recommend that people buy when they go to buy food from either
Mm.
a restaurant or a fast food
Very good,
joint?
very good. The what I will usually recommend is that the food should be a balanced diet, and that balanced diet should have some more of vegetables in it, some more of okras in it, some more of onions in it, some little carbohydrates in it, and less of fat in it. And it shouldn't be so plenty such that you eat
You have
and
to,
eat it late.
okay.
These are some of the issues
So you
we
should not
need to
eat
do.
late.
Yeah, eating late, the food you eat late don't really do much.
Doesn't
Rather, it accumulates inside your body and is being converted to fat
Okay,
in the
so
process.
what of salt? What do you think about salt?
Very good, Prof. Very good. Salt has been a major issue because there are many ways we do get salt. Salt. One is that people can use it to preserve food, and if they use it to preserve food, you cook and still add more to it. And many food today can be preserved with salt, either the the fish, the meat, the um, every other things that they want to keep longer.
They usually
Yes,
preserve in with a salt addition to it. So
addition
the
to
salt
it.
content
Exactly.
is we should worry about the salt
Yeah, we should
content.
worry about the salt content. We will take salt, but we should be careful of the
So
amount we are taking.
we shouldn't take too much salt.
Exactly. We
Okay,
shouldn't take too much salt.
okay,
So always watch that your salt should not, your food should not be salted when you
okay.
are taking it.
Taking it.
And don't add extra salt to the food on the table
Okay,
when you are taking it.
okay. So there shouldn't. So let's say you should not add too much salt, and then all
Yes.
those salt-containing food ingredients
Yes.
should be
Should
avoided.
be avoided.
How would the viewer know whether he or she has a heart problem?
Very good. The first thing is that most of the time you may not know that you have a heart problem until you get late. So you have to have that urgency, that within yourself, you have to be
Conscious.
checking cautious
Mhm.
and checking yourself from time to time.
It's okay. And the
Because
way
there
you,
are group of people that have heart issue.
mhm.
They don't manifest anything. They are asymptomatic.
Okay,
For
that is the.
example,
This
let's
impairment
take,
means that they don't have symptoms.
yeah, they don't have symptoms.
Okay.
Let's take high blood pressure.
Mm-hmm.
High blood pressure is something that we say is a silent killer.
Mm-hmm.
Is there, but if you are checking your BP regularly in the house, you have a machine, this electronic machine, you put finger battery in it, and you tie it around your arm, your upper part of your arm,
Okay.
and you check.
Mm.
It will give you a sign that this BP you are checking is getting
It's
higher.
high. How do we know if the
Yes,
BP is high?
yes, most time people don't have any symptom. But sometimes some people will tell you that when their BP is high, they may have headache. They may just have this funny sensation. They may just have maybe chest pain. And if they go and check their BP is high. But most people that have a high BP, you will never know
May
that it's
not
high.
know. Okay.
It is only at the terminal end that he has given a major problem.
Mm.
And there are three major parts that the BP affects. It can affect your brain, causing stroke, can affect somebody's brain, causing stroke, can affect the heart, causing heart failure or heart attack. It can also affect the kidney, also causing the kidney not to work
Not to
well,
function
not
properly.
to function properly.
Okay. So that's those are the basic things. But
Yes.
so how would I know, for example, that my blood pressure is high?
Very
If I check my blood pressure,
Mm.
so what values are high
Yes,
values?
very good. So here, how do we know that it's high? When you check the blood pressure, there are two readings that will come out: the upper one and the lower one. The upper one we call it systolic blood pressure. The one is the terminal one. The lower value we call it diastolic blood pressure. So if the upper one is 40 and above, consistently above 40, 140 and above,
Okay.
then it's high. If the lower one is consistently 90 and above, then it's high. If you look at our Nigerian Society of Hypertension, that is the definition we agree.
Of
If you also
hypertension.
of hypertension, if you go to European Society of Hypertension, that is also what they agree. But if you look at the American, because now that we are talking, if you listen to us finish, you will still go and check the net, and you will see various values
Yes.
that are appearing in the net. Those values, because various society have various way of defining it. If you go to the American Society of Hypertension, American College of Cardiology, what they accept is 130 for the upper one, then 80 for the lower one. But for us here, we still agree with the
Why are
European.
there this different? Why do we have these differences?
Very good, Prof. The differences are there because many studies have come out. and the way each society take each of the study is also different.
Okay.
Yes, the Americans look at a study we call spring trial, and they felt that the
Okay.
lower the better.
Okay.
Then the European and us also felt that 140 and 90 should still be used. But if you look at even when the definition, the various number are different, it is a spectrum.
Okay.
Yeah, it's a
So what the
spectrum
value
that
we
we're looking
now
at.
take as the optimum level of blood pressure
Yes.
is that value that for most people they stay healthy.
Yes,
So
correct.
okay, so that is how we arrive at these figures.
This
It's not that
figure.
it's just conjecture.
Exactly.
So
It's not
okay,
by
for
conjecture.
those who have figures above the optimal levels, then you find that over time they have
They
one
have
disease
more
condition
disease or the
or
other.
the other.
Very
So
correct,
okay,
Prof.
so thank you very much.
Thank you,
Now,
Prof.
what are the other features, symptoms of abnormal heart function?
The
Well,
other symptoms of abnormal heart function, somebody can have a chest pain.
okay,
If it is the coronary artery are the
or
problem.
the one they call
Yes,
ischemic heart
ischemic
disease.
heart disease.
Okay,
Yeah, somebody can have cough. He can have inability to sleep well in the night. Before the person was sleeping without pillow or
mm.
just using one flat pillow
So now
to
it will
sleep.
require several
Now he
pillows.
requires several
So
pillow, and sometimes he will wake up in the night looking for way
can't
to get air in,
have difficulty in
difficulty
breathing.
in breathing.
Okay,
Sometimes the leg may be
it starts
swelling,
swelling up.
the tummy
But
may
it's
be
not that
swelling.
every swollen leg is due to heart disease.
No, at
Okay,
all.
but
There are
heart
other
disease
things
can
can
also
lead to
lead
swelling
to
of the
swelling
leg.
of the legs.
Exactly.
Okay, thank you. I think those are some of the things that we want to talk about in this episode. Thank you very much for
Thank you.
coming.
Thank you very much, sir.
Please, we will call you again so that you can enlighten us further.
Always, I will be there
And
with you,
our
sir.
viewers, I'm sure, will be itching to hear from you again.
Yes, sir.
Thank you very
Thank
much.
you, sir.
Okay.
Thank you for the privilege.
Thank you, viewers. This is as far as we go for this episode. Please tune in again next time, and we'll give you more on Dr. Daffy. If he comes on again, we'll talk about health and health. Oh, you come again also?
Yes, I
Okay,
will.
so he has agreed to come again. So we'll talk about the heart more. And we also, other episode, we'll talk about other health issues, which I'm sure you will be interested to know about. Thank you very much. See you next time.